All right, here we have a reproductive ectopic pregnancy question. We got a 29-year-old woman coming to the emergency department with sudden onset of sharp lower pain, abdominal pain, dizziness, and she's got vaginal spotting for 2 days. Her last menstrual period was 7 weeks ago. And on physical exam, she's pale and diaphoretic, and her BP is 84/56. Heart rate is 124. And abdomen reveals diffuse tenderness with rebound and guarding. And look at that BHCG. It's going to be kind of high. We got free fluid in the pouch of Douglas. Okay, and an empty uterus. All right, so in this question, the correct answer is going to be ruptured ectopic pregnancy here with your intraperitoneal hemorrhaging. This is your classic life-threatening complication of ectopic pregnancy. It's going to be a rupture, which causes massive internal bleeding. And so the clues in the question are going to be you have 7 weeks pregnant. That's a super crazy early pregnancy. Her last menstrual is going to be 7 weeks. So that's not going to be like a full term at all. Vaginal bleeding and severe pain is a big warning sign for this. Dizziness and hypotension and tachycardia. That means you're going to be in like hemorrhagic shock. You have an empty uterus on ultrasound with a positive HCG. And so that wouldn't be a normal intrauterine pregnancy. And then free fluid in the pouch of Douglas. So that basically means you got blood in the pelvis. The peritoneal cavity, and that's classic for your ruptured ectopic pregnancy. And this can kill you. So super important to keep an eye on this. And let's look at some other answer choices. Incomplete abortion with retained products of conception. Okay, you would show products of conception in the uterus, but not an empty uterus, right? And this person's uterus was empty, I believe. So yeah, it's not typically associated with shock either, or even the free fluid in the intraperitoneal space through the pouch of Douglas. So no. Molar pregnancy, that would cause super crazy high beta HCG, but you'd also see the snowstorm pattern on the ultrasound. And also doesn't present with your acute abdomen or signs of rupture, so it wouldn't be a molar pregnancy. Missed abortion, so fetal demise is with no passage of tissue, but no active bleeding or rupture, and that would not cause your shock or your intraperitoneal bleeding. So the pouch of Douglas, no, you wouldn't see that. Hematometra with your uterine rupture, so that'd be when that's when blood is trapped in the uterus from outflow obstruction. So it's more common in younger females with an imperforate hymen, and the uterine rupture usually occurs in late pregnancy or a previous C-section scar. So this would be super early in the pregnancy, and there's no uterine findings, and so you wouldn't really see that as the answer. So let's just super simple break this down. Normal pregnancy, obviously the baby will grow in the uterus, and ectopic, the baby is going to grow in the fallopian tube. That's why it's super crazy small. You're going to grow a baby in there? No, there's not a chance. So the hematosalpinx, so salpinx means basically the fallopian tube, and hemato means like blood. So what basically you have is you got a mini balloon full of blood that's super dangerous, and it's gonna have a tube that's gonna burst from the pressure and bleed into the belly, and that's what's happening. So it's like a popped pipe that sprays blood everywhere, and it's ectopic. It's an emergency, super bad. So the treatment is gonna be your laparoscopic surgery to remove the ectopic and stop the bleeding, and also methotrexate can be used if it's caught early enough and uninterrupted. But you might see like some other pain, shoulder pain, hypertension, pallor because of the blood loss. And it can cause death in like several hours. But yeah, that's pretty much it. That's all there is to say. Just like blood in the fallopian tube, hematosalpinx, and that's blood inside the fallopian tube. And yeah, that's pretty much all there is to this question. Spotting, internal bleeding. Yep. If this is helpful, then go ahead and like and subscribe if you want more content. We'll see you in the next video.